The Omicron variant and cases tied to holiday gatherings are hitting local hospitals hard. Today, Henry Ford Health System said their test positivity rate is now 41.8%. Doctors there are warning the next few weeks will be extremely difficult.
Bracing for one of the bleakest months yet we have faced throughout this pandemic.
Unfortunately, we are starting to see the effects of the holiday curve and the fast-spreading Omicron variant.
Chief Clinical Officer Dr. Adnan Mankara says COVID hospitalizations are climbing.
As of this morning, we've had 480 patients hospitalized with COVID across our hospitals. That's a 25% increase compared to the past week.
Henry Ford reports 65% of those hospitalized COVID patients have not received any doses of the vaccines. Their tracking finds they are seeing benefits from the booster.
95% of our patients who are hospitalized with COVID or those who are in the ICU have not got their booster vaccine. So it is clear that the vaccine continues to be protective. And it is also clear that the boosters seem to have a significant effect in protecting people from getting into the hospital.
The rapid spread of Omicron is also limiting their availability to give patients monoclonal antibodies.
Not all the monoclonal antibodies that have been approved by the FDA work against Omicron, which has led to supply shortages. We are down to our last 30 doses of monoclonal antibodies today.
They urged everyone to get vaccinated and get their children age 5 and up vaccinated too.
The more we can get people vaccinated if they have not, the more we get people who have been boosted, these numbers will come down.
And Henry Ford did receive a new shipment of the monoclonal antibodies today, and we're calling high-risk patients to come in for treatment. They also expect to get their first shipment of the recently authorized antiviral pills by Pfizer and Merck sometime this month, but warned supplies will be very limited at first, and the treatments are not a substitute for being vaccinated.